The CDC estimates that subvariant BA2 now accounts for 90% of new COVID cases in the Northeast and more than 85% of cases nationwide. It comes as the number of global COVID infections surpasses 500 million. That's according to Johns Hopkins University data to combat the uptick in infections. The CDC is planning to extend a federal mask requirement on transportation, that's planes and trains, through May 3rd. Philadelphia also took action to curb the spread Monday, becoming the first major U.S. city to reinstate an indoor mask mandate. Joining us now with more is CBS News reporter covering health and the pandemic, Alexander Tin. Thanks so much for joining us, Alex. So the CDC just announced plans today to extend the federal mask mandate on planes and other modes of transportation. What is the basis for that decision?
Well, in short, what we heard from the White House, the Centers for Disease Control and Prevention, and other federal health officials is the same message. It's a concern over BA2, that subvariant you just mentioned. And the real question that we've heard from the CDC and from the White House is not an actual concern that BA2 is going to lead to maybe more severe cases or a new surge, but more the uncertainty over what it will bring. When you look abroad, for example, to Europe and to Asia and other countries that have seen surges in BA2 cases, we've seen those surges in cases accompanied by hospitalizations and deaths in some places. And for a long time, what we've heard from federal health officials is a real hope, belief, say what you will about it, that the combination of the high, so-called natural immunity from the winter wave, plus vaccinations, plus booster shots, plus COVID-19 treatments we have in the stockpile, that we would be prepared and able to take on a, for example, BA2 surge without seeing a large rise in hospitalizations. But now, as we are seeing cases go up and hospitalizations go up both around the country and especially in the Northeast, where BA2's prevalence has been highest, you are now hearing from officials, let's wait 2 weeks. Let's see if we see a significant rise in the severity of these cases and reassess after those 2 weeks.
And, throughout the pandemic, we've seen local and state jurisdictions sometimes go beyond the CDC recommendations. And recently, we saw schools in both Philadelphia and D.C. reinstate mask mandates with a specific requirement for either an N95 or KN95 mask. Do you anticipate other mandates to move towards specifying mask types? Because as we know, not all masks are created equally.
No, that's a good point, right? And obviously, one of the main concerns that public health agencies, as well as private organizations like colleges, had very early in the pandemic was the concern, number one, of not enough supply of those kinds of KN95 or N95 high-quality masks, was the availability and the accessibility of those kinds of masks. And then obviously at the end of the day, the actual efficacy that those showed over just wearing a plain cloth or, simple disposable mask, especially when there were some studies that suggested people were willing to wear simpler masks for longer and potentially causing more benefit than requiring these harder to wear masks that sometimes are tighter or fit weird or fog up your glasses or have all these kinds of other comfort issues that might reduce a person's ability to tolerate it for long periods of time. But obviously, a lot of that has changed. Masks have become more comfortable to wear. They're being distributed free and at very cheap costs all around the country, both by the federal government as well as by colleges and many of these other institutions that are instituting these requirements. And of course, what you're seeing is not only all of those concerns being addressed, but an increasing belief that this need to reduce infections, reduce outbreaks, especially in these places where people are living together, mixing together, eating together, and sleeping together on these college campuses, that increasing protection and reducing infections when you think a big surge is about to come is a small price to pay if all you need to do is require these high-quality masks for a short period of time.
Well, all that being said, Alex, recent polling shows that most Americans say they are done with masks. And here we are 2+ years into the pandemic. Can we say with any certainty that mask mandates even work? You just suggested that they do.
Well, there's two separate questions there, right? There's the question of do they work on the population level, right? When you impose a requirement that says everyone needs to wear a mask, are people complying with the mask requirements? Are they wearing the masks correctly? And what kind of exceptions do you carve into that rule? A mask requirement is great until two people get together in their own personal residence with each other from two different households, right? Or go and eat indoors and take off their high quality mask. But setting aside the population level concerns, what you're really dealing with here at, say, for example, the college campus level or in these very smaller communities where people are living together is the hope that any amount of layered protection, like in these situations, is not only going to reduce the likelihood of these big, fast-spreading infections that can completely cripple, an entire college population, for example, but also impact the higher-risk individuals that are that are living and teaching and working in these communities.
I want to ask you, too, about reinfections, because as this new subvariant, starts to spread across the country even more, anecdotally, we're hearing people say, oh, yeah, I just got COVID again. Is there any firm data that you can share about reinfections, whether symptoms are better or worse if you've had it before, or does it really just depend on the person in the particular circumstance?
Yeah, I mean, unfortunately, it really does just depend, right? We know, for example, that reinfections do happen. We know they happen even between people who potentially survived the Omicron BA.1 subvariant and are potentially being exposed to the Omicron BA.2 subvariant. Now, that's not to say that reinfections are common. And obviously, there are a lot of things you can do to reduce the likelihood of getting reinfected. Some of those are the interventions we talked about earlier, like wearing a mask. Some of those are things like getting a vaccine and booster, which when you look at these rigorous studies that the Centers for Disease Control and Prevention have published, you really do see a decrease in the risk of contracting symptomatic COVID-19 if you are vaccinated and boosted against Omicron. But again, I'm not going to lie to you and say reinfections aren't going to happen, because what has become clear, especially during this new wave that we're seeing now, is that reinfections can happen, even if you're vaccinated, even if you're boosted.
All right, Alexander Tin, who has become our in-house COVID expert, thank you for all your reporting and for sharing some of it with us today.
Thank you.